I'm Krista Brady, and today I'm going to be talking to you about the muscles of the head and neck. Before I get into that, let me talk a little bit about the attachment points of muscles. Each muscle will have at least 2 attachment points. One of these will be more immovable. It will usually stay in place, and the other will be more movable. So it's usually the one that will move when the muscle contracts. The immovable attachment point, the one that stays in place, that one we typically call the origin. And the more movable attachment point, we typically call the insertion. So when the muscle contracts, the insertion is going to move towards the origin. Let me give you an example of this using one of the muscles of the face, zygomaticus major, which is right here. Okay, so zygomaticus major takes its origin from the zygomatic bone and comes in and inserts on the lateral side of the mouth. So when you move insertion towards origin, that's going to draw the lateral corner of the mouth upwards, or in other words, that causes you to smile. So for my classes, I'm not going to make you memorize the origins and insertions, but I do expect you to know how they work together. So for example, if I asked you a question about this made-up muscle has its origin here and its insertion here, what would its action be? I would expect you to be able to figure out what action that muscle would do when the insertion moves towards the origin. I would also expect you to be able to do the opposite. If I told you the action of a muscle, I would want you to be able to give me a possible origin and insertion for that muscle. Now let's start talking about some of the specific facial muscles. Let's start off with frontalis. Frontalis is this nice big muscle right here over the frontal bone. So that's where it gets its name. Frontalis takes its origin from the epicranial aponeurosis, which is this sheet-like tendon that covers the top of your head. Okay, so frontalis takes its origin from there and it inserts on the skin of your eyebrows. So moving insertion towards origin, that's going to raise your eyebrows and wrinkle your forehead. On the opposite side of your head, there's a muscle right back here that's over the occipital bone that's called occipitalis. So occipitalis is going to take its origin from the occipital bone and then insert on the epicranial aponeurosis. So moving insertion towards origin, that's actually going to retract the scalp. This isn't going to be a very obvious motion on most people, but some people work that muscle out and are able to do that in an obvious manner. Now moving back to the front of the head, let's look at this muscle that's going in a ring around the eye. This muscle is called orbicularis oculi. The orbicularis part refers to the fact that this muscle is a circle or orb shape, and oculi is referring to the fact that it's around your eye. The word ocular means referring to the eye, so oculi is derived from that. Orbicularis oculi, its action is going to be to close your eyes. Now be careful with this one because some of the other actions that have to do with the eyes, like blinking and winking, those require both closing your eyes and opening your eyes, and orbicularis oculi only does one of those. It closes the eye. So the muscle that's going to open the eye is levator palpebrae superioris. Levator palpebrae superioris is not shown on any of the models that we have available, so I'm going to refer you to the pictures in your textbook and the other resources that have been provided to you. So levator palpebrae superioris, that one is going to come in and insert on the upper eyelid, and its origin is on the sphenoid bone, so when that insertion moves towards that origin, that's going to open the eyelid. All right, moving right along, let's go farther down on the face and talk about this circular muscle that is surrounding the mouth down here. And so it goes all the way around the mouth. This one is called orbicularis oris. So it's using that same term, orbicularis, to refer to the fact that it goes in a circle around the mouth. And then the second name, the second part of its name, oris, refers to the fact that it's going around the mouth. Remember, the mouth is the oral region. So orbicularis oris is going around the mouth. And that one is going to close the mouth, and it also helps you to pucker your lips. So in The Little Mermaid, when Sebastian tells Ariel, you've got to pucker your lips like this, then he's using the orbicularis oris muscle to do that action. Let's look again at zygomaticus major right here. I'm just going to point that one out one more time. Notice that it is taking its origin from the zygomatic bone right up here and then inserting on the lateral side of the mouth. And that is going to draw that lateral corner of the mouth upwards to cause you to smile. And then we have a deep muscle on this side. So one thing I also want to point out with muscles is that you have layers of muscle in your body. And so sometimes, if you're looking at one side of a model, this is going to be the superficial side. And so you're seeing a more superficial layer of muscles, which means that some of the deeper muscles are covered up. So a lot of models and charts have a superficial side and a deep side. And it's important to orient yourself when you first look at a model or chart and figure out which side is which. So here we're going to turn over to the deeper side. You can see the bone here, so you know this has to be the deeper side. And so this muscle right here, it's taking its origin from the molar regions of the mandible and maxilla here, and it's coming forward to insert on orbicularis oris. So when it contracts, it's going to move orbicularis oris backwards, and actually its action is to compress the cheeks, and it also helps for actions like whistling, sucking, and blowing. And then finally, one other muscle that we also don't have shown on most of these models is called platysma. Platysma is a muscle that's going to take its origin from down on the chest. It actually inserts on the connective tissue around some of the other muscles, and then it comes up and it inserts on the lower part of the mandible here and the lower lip. And so it covers your entire neck, kind of like a bib. When this muscle contracts, it's going to depress the mandible, so it helps open your mouth. It also can cause a frown expression or a grimace like this. That's platysma. So those were all the muscles of facial expression. Now let's talk about the two muscles of mastication, which is the formal term for chewing. There's one muscle here on this deeper side of the model that's sitting right over the temporal bone right here, and its name is temporalis. Temporalis is going to come down and insert on the coronoid process of the mandible. So moving that insertion towards that origin, that's going to elevate and retract your jaw, which are very important actions in chewing. The other muscle that's involved in mastication is over on this side. It's this big muscle right here. I'm going to tilt that model up a little bit. So it's this big muscle right here. There is, by the way, this is a salivary gland right there, so don't pay attention to that right now. This muscle is what we're looking at. This is called masseter. Masseter is going to take its origin from the zygomatic bone and part of the temporal bone here and come in and insert on the angle and ramus of the mandible. So again, moving that insertion towards that origin is going to help elevate and retract your jaw to help in that process of mastication. Next, let's talk about a couple of muscles on the neck that are going to help move the head. So the first that we'll look at is right here. It's called sternocleidomastoid. And sternocleidomastoid actually has two origins. It takes an origin from the sternum, and it takes an origin from the clavicle, and then it comes back and inserts on the mastoid process of the temporal bone. So that's where its name comes from. Sterno, from where it inserts on the sternum, cleido, from where it inserts on the clavicle, and mastoid from where it inserts on that mastoid process. Sternocleidomastoid can do a couple of things. When that insertion moves towards that origin, if you contract both, the one on the right and the one on the left at the same time, that's going to flex your head. If you just contract one of them, that's going to do contralateral rotation of the head, meaning that you are rotating the head away from the side where the muscle is, like that. So that's sternocleidomastoid. Next, let's talk about this big muscle back here. So you're only seeing part of it on this model of the head and neck. I'll show you this again on a torso model. But this big muscle here, and when you see the whole thing, you'll see that it's kite-shaped, and it's called trapezius. Trapezius has a lot of origins and insertions, and it is going to do several things. The thing that it does with the head is it is going to help extend and hyperextend the head. And then it will also do a lot of things that have to do with the scapula that I'll tell you in a little bit. And then finally, one other muscle we're going to look at right now is this one right here. This is called splenius capitis. Splenius capitis takes its origin from the cervical vertebrae and some of the thoracic vertebrae, and then comes up and inserts on the occipital bone and the mastoid process of the temporal bone right here. And so if you move that insertion towards that origin, that's going to help extend and hyperextend your head as well. Now let's talk about the extrinsic eye muscles. These are the eye muscles that are on the outside of the eye, and they're going to help move the eyeball. So you'll probably notice this big one on the top of the eye first. So this is on the top or superior part of the eye, and it is a straight muscle. It's going to go straight back towards the sphenoid bone. That's actually where it takes its origin from, and then it inserts on the outer part of the eye, which is called the sclera. So anyway, it's a straight muscle on the superior part of the eye, so its name is superior rectus. There's also one on the bottom of the eye, which you can't see very well on this model. It's right down there underneath. And it's also straight, and so its name is inferior rectus. Okay, then you'll notice that there's a straight one on either side. This one is on the medial side of the eye, and I'll tell you in 1 minute how to tell whether this eye is a right or a left eye. But since this is on the medial side, and it's also a straight muscle, it's called medial rectus. And then on the lateral side, you have a straight muscle called lateral rectus. All right, so how do you tell if this eye is right or left so that you can figure out whether that muscle that you're looking at is a medial or a lateral rectus? This lacrimal gland is going to be a nice clue. The lacrimal gland is on the lateral side. LA for lacrimal, LA for lateral. And by the way, the lacrimal gland, that's the one that's going to produce tears. So that's your tear gland. So that's going to tell you that this side of the eye is lateral, so this would be a right eye. There are a couple of other clues that you can use as well, using the other two muscles that I haven't yet shown you. So there's another muscle it's actually going to come along. You're not seeing most of it on this model. It's going to come along on the medial side of the eye, and then it goes through a strange ligament that's shaped like a pulley. And it's going to come around and insert obliquely, diagonally, on the superior part of the eye. So that muscle is called superior oblique. Superior oblique. And that one is on the medial side. So that will also help you tell whether this is a right or a left eye. And there's one more muscle that you're also seeing not much of on this model, but you see a little bit of it right here. And this muscle is going to come around on the lateral side and insert obliquely on the inferior part of the eye. So this one is called inferior oblique. Now, you don't have to know the specific actions for my class. You don't have to know the specific actions of these extrinsic eye muscles, but you do need to know their innervations. These extrinsic eye muscles are all innervated by cranial nerves. And so most of them are going to be innervated by cranial nerve 3, oculomotor. But there is one, this superior oblique, that is innervated by cranial nerve 4, the trochlear nerve. And this muscle, lateral rectus, is innervated by cranial nerve 6, the abducens nerve. So I'm going to teach you something to help you remember the innervations of those eye muscles. So the memory device to help you remember the innervations of the extrinsic eye muscles is kind of like a chemical equation almost. It's not a real chemical equation, but having it in this format makes it easier to remember for many students. So this chemical equation is LR6 SO4, and then parentheses with a 3 outside. So what that means, the LR stands for lateral rectus, and there's a 6 next to it to help you remember that cranial nerve 6 innervates lateral rectus. The SO stands for superior oblique, and it has a 4 next to it to help you remember that cranial nerve 4 innervates superior oblique. And then the 3 outside the parentheses is to help you remember all the rest are 3. All of the other extrinsic eye muscles are innervated by cranial nerve 3. Today I've taught you about the muscles of facial expression, including frontalis, occipitalis, orbicularis oculi, zygomaticus major, orbicularis oris, buccinator, and the muscles and platysma, which is not included on this model, as well as levator palpebris superioris, also not on this model. I've also taught you about the muscles of mastication, including temporalis and masseter, and the muscles that move the head, sternocleidomastoid right here on the front, and trapezius, and splenius capitis on the back. Then I've additionally taught you about the muscles, the extrinsic eye muscles, superior rectus, medial rectus, inferior rectus, lateral rectus, superior oblique right here, and inferior oblique right here. Now go ahead and practice these muscles using the labeled and unlabeled images provided, and then you can apply these on the lab exercises.